Hello and welcome back to Dr. Carri's Clinical Corner. And today I want to talk about erectile dysfunction. So often men will call my office asking if I treat erectile dysfunction. And my honest answer to them is maybe pelvic floor therapy can help, but it's never the whole picture. So that's my honest answer to you as a pelvic floor therapist. And you know that's honest because if I just told everyone like, yeah, pelvic floor therapy can help, like that's secure, great. But let me say something really important first. Erectile dysfunction is linked to it as an early sign of cardiovascular disease, of heart disease. So if you're having erectile dysfunction, and this is what I tell all my patients too, is you need to see your doctor, you need to get blood work to make sure you don't have high blood pressure, heart disease, things like that, because that's sort of like what studies are showing is like erectile dysfunction is an early sign of heart disease. So let's talk about why that is. So what causes an erection? Blood flow into the penis, and then the vein closes off to keep the erection, right? And then after orgasm or after it's over, the vein opens up, blood flows out, and the penis goes back to being flaccid. So if you can't get enough blood flow, if you have like plaque in your arteries or some like vascular blood flow heart disease, that again makes sense why it's an early sign, right? So if the blood can't get into the penis and it can't stay there, then it's usually a blood flow problem. So there can be other factors. So I do see men in my clinic for if their only complaint is erectile dysfunction. So we work on pelvic floor muscle. So in the clinic, we'll work on the pelvic floor muscle. So imagine if this is the bottom of me. If I'm a man, and I'm not, but if I'm sitting, that's what we're looking at, okay? So I'll show you next to the female model. So this is like the 3D, this is the spine and the back, right? So we're looking at this. And if you look at them, they're similar, just a penis or a vagina, but they both have the same triangle in the front, and then the anus, the rectum. So the thing we will work on in pelvic floor therapy is making sure all these muscles at the base of the penis are working properly. So that means they're resting when they should, so that blood can flow into the penis, and that they're strong when they should be. So generally, it's the vein gets blocked off and closed, and that keeps the erection. But we want to make sure the muscles can do their part too. And then when it's time for the erection to be over, the muscles can relax and the blood can leave. That's the gist of what we do in pelvic floor therapy. But again, if you have erectile dysfunction, get blood work from your doctor, get your heart checked out, your vascular system, and you should continue to check it because, again, for a lot of my young male patients, I'm like, if you're in your 20s or 30s and you're having erectile dysfunction, that's not good. It's not good if you're in your 70s or whatever age you are. But yeah, we really want to keep a check on your heart and your blood work to make sure that's that. So it can be pelvic floor therapy can be helpful. I think it can be a piece of the puzzle, but I never guarantee my men that like this is gonna fix your erectile dysfunction. So oftentimes it seems kind of backwards, but oftentimes it's really these muscles are tight at the base of the penis, so they need to relax so blood flow can fill it up. So rather than everyone thinks Kegels, I gotta get stronger, but a lot of my men, we actually work on stretches, like inner thigh stretching, happy baby, figure four stretching to kind of open up the muscles around this. There's no direct way to stretch the pelvic floor, so I kind of work on the surrounding muscles, but that's really it. And so the other thing, and I'm not too versed on this, but I know shockwave therapy can be helpful, and I don't fully understand it, and I'm not, again, well versed on it, and I can't do it in my clinics. It's kind of new, it's very expensive. Some people say it's painful, some people don't, but that has shown some promise. And then sometimes there's trauma, there's mindfulness, there's a lot of ways to approach this, but my thing is get your blood work checked by your doctor. Maybe see a pelvic floor therapist. Maybe you need to work with a mental health therapist on mindfulness techniques. I have had some patients with some other random things, but not super common. Yeah, get checked for STDs. That can be an issue too. So I always, if any men want to come see me for erectile dysfunction, I'm always like, you need to get cleared by your doctor. Blood work, STDs, like generic health stuff to be ruled out. I will also say this as a side note. So for my men that have had prostate surgery, erectile dysfunction is super common after that. So we work on all these things. They generally have weakness of their pelvic floor because the nerves were disrupted in the surgery. But for them, we also recommend penile pump so that the penis doesn't shrink, because if it's not getting erections on a normal basis, it can shrink, and then it will be harder if you get that ability back. So I don't know. I've never really used that for my non-prostate patients. But maybe. So normal is for men, you should have like 3 to 5 erections overnight. And so these aren't like wet dreams like we talk about when you're like a teenager, but that's normal, just the blood flow stretching out those tissues and then leaving. So morning erections is normal and healthy. So if you're not getting those, that's really a sign that there's dysfunction. And if you are getting those, but you can't have erections on the spot, like willfully, then maybe it's something else. Then maybe mindfulness, maybe pelvic floor therapy. Obviously there's lots of drugs, Viagra, Cialis, those kind of things that can help. Yeah, but nighttime erections are normal. They're healthy. We want them. And that's something to sort of pay attention to too. Like, do I not have morning erections anymore? That's not good. But if I have like nighttime erections, but I can't get erect when I'm aroused, then that's something else we got to work on. So then maybe it's like the muscles are getting in the way or our mind is getting in the way. Yeah, so that's sort of erectile dysfunction, an overview from pelvic floor therapy perspective.